I often tell the story of my having gone away to school thinking that I was going to follow my father into the ministry. Around my third year at South Carolina State, I had a change of heart, and I went home to tell him why I thought I would change directions. It was not an easy thing for me to do. I took about 3 hours to make that 1 hour trip so I could tell my dad of my decision not to go to the seminary. I will never forget, my dad paused for a few moments after I shared with him my decision, and then he spoke these words. "Well, son," he said, "I suspect the world would much rather see a sermon than hear one." It was with those words that I embarked upon my public service career, and I brought that ideal here to Washington with me. And when Nancy Pelosi asked me a few years ago to take over the chairmanship of the Faith Working Group, I was not too sure that was something I wanted to do. I thought that maybe one of the other ministers, ordained ministers in our caucus, would be better in that position. But she insisted that I do it, and so I went to talk to my pastor down in Charleston to ask him what he thought I should do. He told me he was not going to tell me what to do, but he asked me to go and reread the book of James. And those of you who have studied this part of our history, you know that that's a book that was written at a time that the people of faith were trying to decide what their roles ought to be. How should they go about expressing that faith? And James said to those, in writing his epistle, he said to all of us that faith without works is dead. And I do believe that if James were writing his epistle today, he would not say just to clothe the hungry, the naked, and feed the hungry. I believe that James would tell us that we have a responsibility to take care of those who are sick and shut in, that we ought to be about providing health care for the people who need it in our great country. I'm convinced of that. And we must do that in such a way that it's not just health care being provided. It's got to be accessible. It's got to be affordable. It's got to be quality. It's got to be choices. All of those things have got to be, and that is what this president is presenting to us. That is what the House did last Friday when it released its working draft. It is a plan that's affordable, it's accessible, it's high quality, it provides choices. It is what we need to do for the American people, and your being here today is a big shot in the arm to help us get that done. And so I want to thank you. I want to thank you for being here. I want to thank you for doing what I know you will be doing over the next 2 or 3 weeks. We are going to get an energy bill out of here this week. And when we come back after the 4th of July break, we are going to tackle this health care issue. And with your help, we are going to do what people in this country have been wanting to do since the 1950s and we've been writing about since the 1960s. We are going to say to everybody in this country that health care is a right for each and every one of us who are Americans. And so thank you. Thank you so much. I look forward to working with you, and I'm looking forward to next year, looking back on this year and saying we finally got it done. Thank you and Godspeed.